Welcome back to the Stay at Home module. I am Pamela D. Wilson, caregiving expert, advocate, and speaker. I am your host. I am your instructor for this module. In this module, we are going to talk about the cost of in-home care for the elderly and how to manage that. What are the costs? How do you save? How do you prepare? As always, we are going to start with the housekeeping slide that I always begin with just to go through this. You know that I use the term elderly parent or elderly parents for the person for whom you provide care. The outline for this module is in the course materials. Do print everything out so that you can follow along. Let's talk about the objectives of the cost of in-home care for the elderly and beyond. At the end of this module, you should be able to recognize the costs that contribute to providing care for elderly parents, identify the different types of services and care available, and initiate discussions with your elderly parents about care costs and planning. Talking about money is another challenging task that you have because most elderly parents want to live at home. We all do. Few people ever dream of living in a care community or moving to a nursing home. Yet the problem is that we don't want to talk about aging, sickness, and death. For the most part, these discussions don't happen until a person actually needs care, which is a little late. It's better to have these discussions long before anybody needs care. We don't. Because a lot of people live for today, the realities of tomorrow seem so far away into the future that we rarely think about them and rarely plan for them. Let's talk about the objectives of why there's never enough money. At the end of why there's never enough money, you should be able to discuss the hard costs of care that correlate to chronic disease and longevity that we have been talking about throughout this program. You should be able to revisit how healthcare bias can affect care for elderly parents and connect how the healthy spouse and adult children caregivers delay care costs, and then consider what steps you want to take to plan for care for your elderly parents if and when that money runs out. Why don't families talk about elderly parents needing care? Sometimes it happens, sometimes it doesn't. Some elderly parents do try to talk to their children about the likelihood that they may need care because they have known health issues. Many times children avoid these conversations because as children, we don't want to talk about the unpleasant subjects of getting sick or death for our elderly parents. Those situations we view as being years off into the future, maybe never going to happen. A lot of adult parents will come to me and say, oh, I wish my kids would talk about this. I wish they would be willing to talk about care and care costs and planning for care. I don't know how to get them to talk to me. Well, in my family, this was also the situation. I can tell you that when I was in my early 30s, one day my mom came to me and she was all excited. And she said to me, Pamela, guess what I've done? And I said, oh, Mom, what did you do? She said, well, I bought your father and my burial plans, and it's planned to the last detail. What we're going to wear, the flowers, the mass, the prayers, the obituaries, everything is planned, so you kids don't have to worry about this. Now, I started crying. I didn't want to talk about it. I wasn't prepared to talk about it. She didn't really soften the subject. My mom just brought this up out of the blue, and I was totally unprepared. And she, in her wisdom, because she had experienced this with her parents, she took care of her father's funeral. Her mom died when she was very young, but she knew what it was like to go through this for multiple family members who had passed away and her involvement. What she was trying to do was prevent us from having to go through what she went through. She didn't present it as well as she could have, so that I maybe would have been in a place where I was willing to talk to her about it and where I understood. But in retrospect, that was one of the best things that she did for us as children, for both her and my father, because when they both passed away and we were flying home across country for those funerals and coming home for those funerals, not having to make those plans was a relief. Because if you could imagine, think about it this way. People plan to get married. When you plan to get married, if you plan to have a ceremony, you plan for months. You're planning for months and you're planning all the details and you're very excited about it. You have all this time. But when somebody passes away, imagine that you have 2 days, 3 days to plan a funeral. So when you think of all of that planning for the wedding, if you compress that into 3 days, imagine how stressful that is. One of the suggestions that I have when talking to elderly parents about planning for care costs and planning for end-of-life care is to have serious conversations about pre-planning for burials or pre-planning for cremation or whatever type of service your parents want. It really does make it easier at end of life because there is a snafu that most people don't talk about. When your parents die, they should have a medical and a financial power of attorney appointed and a personal rep who manages the money after death. Well, after death, the money in those bank accounts is frozen. You can't access that without a death certificate, without information, without opening probate, things like that. You have to have paperwork to be able to get to that bank account. If you can't get to the bank account, you can't pay for a funeral or for a cremation, which is why prepaying is a good idea. Also, the same idea of planning for care costs. Funerals and cremations, the costs go up 6 to 10% every year. So if you purchase a plan today, you will save a lot of money in not having to pay for it later. And then also, when your parents pass away, at the time that that happens, you have a plan in place, you know what's going to happen, and you don't have to worry about it. Extremely, extremely important. So let's talk about conversations. Let's get back to that. So conversations are delayed. And this happens because there is this, I call it an in-between stage, that exists between a parent having a chronic disease to the time that they need care, to the time that the healthy spouse is that caregiver, to the time that the adult children become involved as caregivers. The reality is the healthy spouse buffers that care situation as much as possible for as long as possible before coming to you children to ask for help. Adult children start to help out with household or yard tasks. Then it progresses to picking up prescriptions and groceries, maybe doing a little housework. And at that stage, many children see themselves as helping out. They don't see themselves as the term of being a caregiver. Why? It's not until mom or dad fall and break a hip or that chronic disease progresses to the point where ongoing doctor appointments, treatments, medical care are a reality that talking about it, we can't ignore it anymore. We can't delay it anymore. And then what happens is families find themselves scrambling. They're trying to figure out, oh my gosh, what do we do? How do we pay for care? How do we take care of mom or dad? Which brings us to this subject of money. And my favorite saying, why we can't put a price on life. The reality is no matter how much money you have, if it's millions of dollars, if it's thousands of dollars when a parent retires or when we retire, the emotional aspects of wanting to care for an elderly parent, a spouse, a family member, that results in us feeling that there never could possibly be enough money because we can't put a price on life. Life is priceless. And when I say this mentally, you might understand it, you might be able to conceptualize it, but let me paint an emotional picture for you about this that some of you probably might understand. So in the photo on this slide, I purposely put an elderly man hugging his dog because for those of us who have pets, honestly, they do become like family. In my family, we usually would adopt dogs from shelters because we wanted to give them a good life. And sometimes we adopted the dogs that were not always so healthy. For many years, we had Bichon Frises. If you know what those are, they're little white fluffy dogs, and I think they're just adorable. The first one came from one of my bosses who had bought the dog for his child with the agreement that the child would take care of the dog, and that didn't happen. So he came to me and he said, I know you love dogs. Could you possibly take this dog? We don't want to give it to a shelter. My daughter said she would take care of it. She's not, and we don't want the dog to be neglected. So that dog's name was Cece. So I adopted Cece. And at the time, I had another dog whose name was Daniel. Daniel passed away and Cece survived him and was lonely. And so I thought, okay, I have to go get another dog because 2 dogs are always better than 1 for companionship's sake. So I went to a Bichon rescue and adopted a dog named Eddie Earl. And Eddie Earl had what was called white dog shaking syndrome, which was kind of like Parkinson's. So he had health issues, and you could tell that he had been abused by men because he didn't really like men. And so we had Cece and Eddie Earl, and they lived to be pretty old. 12, 13, 14, 15 years old. But toward the end of their life, they had a lot of medical issues, especially Eddie Earl, because he had this white dog shaking syndrome. There were some months when we had vet bills that were $500 a month or $800 a month, sometimes $1,000 a month. And that is that emotional aspect of, oh my gosh, I have this pet. I love this pet. This pet is like our family. How could I not agree to this medical care to pay for care? Now, obviously, at end of life, even if you paid for the care, it wouldn't keep your pet alive, or it doesn't keep a parent alive. But throughout all of that, we spent a lot of money on these dogs, but they gave us so much joy. So if you can translate that somehow to caring for an elderly parent, and every time an expense comes up, it has to be paid and you want to pay it. And sometimes if people have cancer, the copays for treatments are in the thousands of dollars. $3,000, $4,000, $5,000 for treatment every 4 weeks, every 6 weeks. Care becomes expensive, and no matter how much money you have, there is never enough money to help a loved one or to keep one of your pets alive. Let's talk about money a little bit more. So the government doesn't have a comprehensive program that takes care of the total care of elderly when they age, unless, of course, people have no money. So that takes us back to the first shock about care costs, is when families learn that, oh my gosh, Medicare doesn't pay for the type of help that most older adults need to stay at home. Medicare is health insurance. Consumers believe that contributing to Medicare and Social Security all the years we work is really what it takes to take care of ourselves in retirement. That's not enough. The system does not work that way. Unless you have no money, and at the point in time that this comes up, no money means Medicaid and a monthly income of about less than $2,500 and no savings, no investments, no second properties, no assets except the home that you live in and a car and this income of $2,500 a month. That Medicaid threshold, it does change every year. It varies by state program. So soon this $2,500 may be more. If you meet that income threshold and you cannot physically care for yourself, know that there are also guidelines for what cannot physically care for yourself means, then you can apply through Medicaid through an HCBS waiver that provides in-home care, or some assisted living communities will accept Medicaid. And then there's this Medicaid long-term care, which is nursing home care. Medicaid doesn't pay for custodial care, which is help with daily activities like bathing, dressing, meal preparation, managing prescriptions, unless you are at a point where you meet those 2 criteria. Income of less than $2,500 a month, physical needs, and no other way to pay for care. What does that mean? It means that family members pay for this care. Family members, the healthy spouse, the adult children, they are the ones that provide this custodial care for years, and then medical care for years, as long as an elderly parent continues to need more care. The reason it becomes so expensive is that medical care and insurance is expensive. This slide is, in a sense, a review of the information in a lot of the prior modules that really talk about how our lifestyle habits into our 20s, 30s, and 40s start with that little diagnosis of chronic disease that is not too annoying, but then progresses. Elderly parents with one or more chronic diseases will have more frequent interactions, more visits with the healthcare system, with doctors, prescriptions, tests that will result in higher and escalating healthcare costs. Chronic disease is a result of not being physically active. Mostly, that is the biggest cause. Add together to that smoking and high cholesterol and a few other issues. So a lack of physical exercise and a diagnosis of chronic disease means a couple of things. There is a higher likelihood of needing more care. There's a higher likelihood of being diagnosed with dementia or Alzheimer's, which skyrocket the costs of care. Physical activity, a good diet, maintaining that reasonable weight, not smoking, all preventative factors that few people talk about until we have this train wreck, until our parents or us are shocked that we have high blood pressure, diabetes, COPD, or another life-affecting diagnosis. Changes in health will happen to all of us to differing degrees. It's inevitable. The fact of life that we don't want to talk about is the fact that we are born and we eventually die. It's not anything that we can avoid. Medical issues are the leading cause of the healthy spouse and adult children becoming more involved in care. You will eventually do tasks like taking blood pressure, blood sugar readings. You may bathe a parent, help a parent change Depends, give insulin injections, make special diets, use lifts. That is typical. A lot of family caregivers perform these functions for which there is little or no training. What is your plan for what you will do, for how you will handle this? Many of these tasks were previously completed in hospitals or in nursing homes, and they are the responsibility of family caregivers. The family home, in a sense, becomes the new hospital. And there is research out there that talks about the fact that one of the main preventive factors for increasing costs of care is the dedication and the effort of the healthy spouse first, and then the dedication of a daughter who is involved. So the healthy spouse, usually the wife, and the daughter take care of the husband. If you reverse that situation, and there is no daughter, there may be a son, the husband can take care of the wife and does take care of the wife for a period of time. But the facts show that more often than not, the husband places the wife in a care community or in a nursing home because he and the son cannot manage those care issues. When you reverse it, the healthy wife and the daughter keep the husband at home as long as possible. It's because women are more of the caregiving type, and men feel less able to care for a wife. They sometimes stress over the difficulties, and they are less likely to seek support from caregiving support groups. They are more likely to pay for care. So there is a difference in how men and women approach caregiving. It's important for us to talk about and important for us to know. Let's talk about preventative care and the expenses. Preventative care is expensive, but the alternative, being in poor health, is much more expensive. Preventative actions that support health reduce medical care costs. They are proven to improve quality of life in old age. As a family caregiver for an elderly parent, we've talked about the fact that you will likely be exposed to healthcare bias. That means that happens when a doctor denies costly treatment or testing because the outcome of your parents' health or their day-to-day life won't change. Having chronic diseases, being in poor health, and being viewed as non-compliant, which means your elderly parent hasn't followed recommendations in the past, takes away options for care and treatment, unless your parent has the money to pay for treatment and testing privately. But even sometimes that isn't an option because there are rules and regulations about Medicare. Sometimes providers cannot accept private payment for a service that Medicare offers. It's not allowed. And so if your physician won't even approve that service, that is the first problem. Paying for it then becomes a non-issue because he won't recommend it. The system is really complicated. Having money to pay for care privately does provide more options in many cases to get the care that we want. Preventative care is the services that we as individuals choose to pay for so that we can remain healthy. For those of us who are younger and older, these include things like gym memberships, personal training, massages, chiropractic care, alternative care like acupuncture, and other services that are not reimbursed by health insurance, vitamins, healthy food. Believe it or not, until you start spending this and you realize that cost for preventative care can actually exceed the cost of your health insurance and medical care every year. So it's a balancing act. When we're younger, we pay more for prevention. If we don't do that, when we're older, we pay more for medical care. Being preventative at a younger age reduces costs of medical care when we're older. The reality is that as consumers, we choose the products and services that we value. We spend our money every day, every week on items that we value. The question is, will you choose to value your health and products and services that support your health, knowing the long-term benefits? Or will you choose to spend your money on electronics and things that may not have a long-term benefit, but may bring you a lot of pleasure today? Preventative care is expensive, but the alternative of being in poor health, even more expensive. Then we talk about life-changing events. And a life-changing event is when you or an elderly parent are diagnosed with a chronic disease. The healthcare system is impersonal, meaning that they treat diseases. That is their job. Many times patients become stressed because they feel like they are treated like a disease instead of a person. Being sick is stressful. Having a chronic disease is stressful. Taking care of an elderly parent with a lot of diseases is stressful. The medical system does not address that, and it really isn't their responsibility to address it. Their responsibility is to focus on the treatment and the care that patients and the elderly need, which is why there is a disconnect and why many consumers feel like the healthcare system doesn't care and they set up roadblocks. The healthcare system has a lot of constraints. That emotional aspect of feeling like you are a disease to a provider instead of a person may not be something that we ever get across. It may be something that we as caregivers have to fight, that healthcare bias, throughout the lives of our elderly parents. But we in the family can be empathetic. We in the family can take care of each other and be supportive and get caregiver support, which is extremely, extremely important. It's why you're here. It's why you're taking this class, to become more educated and more knowledgeable about how to manage your health issues and the health issues of elderly parents. Caregiving is that family responsibility. Adult children help as much as possible, sometimes, and you know this, 20 or 30 hours a week or more. You may be contributing money to the care costs for aging parents. As we talked, a lot of cultures believe that it is the responsibility and duty of adult children to help elderly parents stay in their home instead of moving them to a care community or a nursing home, but even sometimes that becomes an eventuality. The downside of this that we have talked about is that the healthy spouse is the first caregiver, and then one child, usually a daughter if one exists, becomes the primary second caregiver. Many times other families don't offer to help, or other family members don't offer to help. They go on with their lives, and this can cause a lot of friction and fractures in family relationships. The healthy spouse and that adult child, usually the daughter, take on all of the care responsibilities, and as a result, they have effects. They become physically ill and emotionally run down. And here's the concern that most people don't think about. Most of that family money might be spent on the first spouse who becomes sick and passes away. That leaves little or no money remaining to pay for the care of the healthy spouse or the daughter who gave up her job, who gave up income to be that caregiver. We'll talk more about this. Chronic diseases and illnesses of elderly parents and those responsibilities of caregiving are the components that make caregiving relationships difficult and the reasons that families do stress about money, about worrying if there is enough money. So let's talk about how the healthy spouse and adult children can delay care costs. Years before children become involved, as we discussed, that healthier spouse manages all of the household concerns. Parents are concerned about asking their children for help. Stress for spousal caregivers, it is so significant. Some parents purposely don't involve children in caring for a sick spouse for as long as possible. They may fear that they will be judged or feel that you, their children, won't understand care responsibilities. It's similar to the healthcare system not understanding the emotional aspects of having a disease. Adult children many times don't understand what it is like to be that spousal caregiver because honestly, you have no experience with caregiving. You've been healthy. You can't imagine what it's like to take somebody who doesn't take care of somebody who doesn't feel good every day, who may complain, who may yell, who may be a little abusive because they don't feel well. Many times in situations, there will be families who say, I don't understand why my mom won't allow me to help. Or my sister's taking care of dad and she seems a little distant. She's saying that she doesn't want us involved. Why do you think that happens? It's not for the reasons that you think. It's because you don't understand. And I say this many times that it takes another caregiver to understand what a caregiver goes through, to understand what that night and day, the 24/7 care is like. Caregivers, if they are resisting help, there are a couple of reasons. One is a negative situation in that they may be overbearing or want total control of the situation, so they don't want you involved, so that you don't know what's going on. And that's more in situations where financial abuse occurs, and we'll talk more about that. But generally, if a caregiver is refusing help, the people on the outside may be criticizing the caregiver, maybe saying things like, well, it can't be that hard, or why don't you do this? You're giving a lot of unsolicited advice, but you're not offering to step in and help. That is the difference. Caregivers are pressed for time. They have long days. They have long lists of things to do. Taking care of you and taking care of your needs for information, your emotions, that's more than they can even accomplish with everything else that they have to do. The caregiver's job is not to take care of people on the outside. They're taking care of the spouse, a loved one, a brother, or a sister. The best thing that you can do as the person on the outside is offer to help. Say, every Saturday, I'm coming over at 1. I'll give you 4 hours of my time. You give me a list. I won't ask you any questions. I won't complain. I'm here to help you because I want to support you. I know you're working very hard. I know you are exhausted. I can't imagine how difficult this is for you. How can I make this easier for you? That is how you help. You don't help by asking questions. You don't help by not showing up. And you don't help by saying, let me know if you need help. They're not going to ask in many cases. You help by saying, This is when I'm available. This is how much time I have. This is how I can help you. When adult children become caregivers, when you do become involved, you and the healthy spouse, in a sense, provide assisted living type support for activities of daily living that your elderly parent can no longer do for him or herself. You're helping with bathing, in some cases, dressing, grocery shopping, preparing meals, transportation, medications, housekeeping, long list of things to do. The first time that you give a bath to your mom or dad, you may be shocked when you realize that they are bone thin, they have skin issues, and you really see them as the frail state that they are in. What you want to realize is this may be a scary situation for you, but find support in caregiving groups, whether they are online, whether they are in person. Other caregivers have these experiences and they can help you with suggestions. People like myself can help you with suggestions because these are common situations that happen as caregiving progresses. And rather than being shocked thinking, I'm never going to bathe my parent, if you can talk about what it's like for other people and understand and be understanding. Your parent is mortified that you have to help them. They are embarrassed that they need this type of care and they can't take care of themselves. So it's so important to be compassionate and to understand. As we talked about this, we talked a lot about bathing and embarrassment and managing incontinence in another part of these modules. The other thing is to really, as you go through this and see that your parents need more care and that more money is going to be spent, really think about the time commitment. And if you are a full-time working caregiver, really think about what happens if you do decide to take off work or leave to take care of that parent, because that can go on for years. These are definitely conversations that you want to have. And while you want to be helpful, you don't want to regret that you feel guilty about not helping or that you left a job and you can't replace that income, because that does happen. So how do we plan for what to do when money runs out? In a perfect world, if you can talk about money for care before parents need care, that's ideal. Rarely happens. If you can have that conversation when your parents start to need care and look down the road 3 to 5 years before that money comes out, that is another good time. And I know that it can be challenging to predict the cost of care, which is why we're having this conversation. If you've been a caregiver for some time, your parents may already be past that 3 to 5 year planning time frame. They may be running out of money now or within the next year. In an earlier module, we talked about creating a time and a financial budget. If you don't remember that conversation, and if you have not done that, if you've not started those activities, you might want to go back and watch the module called Managing Emotions, Family Relationships, and Elderly Parents Who Refuse Care. It is the first module in this series. Go back and watch that, and then come back and watch this section again. So revisit the information, create a budget based on the current situation, and then you'll be able to update the budget based on costs that I'm about to share with you. I know it can be very difficult to try to have a crystal ball to predict what can happen in the future, because one little thing can change everything. But one gauge that you can look back at is to just look at how the care needs of your parents have changed in the past year, 2 years or more, and then take a very realistic look at their health, their diagnosis. If you haven't talked to the doctor about the progression of health of your parents and what is likely to happen, if you haven't done that yet, do that now. You can also hire a local care manager, and I'll talk more about what that is, who has a lot of years of experience working with the elderly, who does have the skills to help you project cost of care. I was a care manager. I helped many of my clients in this role to plan and to make decisions about their future care. Let's go back to that idea of 50-50 and your parents participating in their care, because a significant part of predicting costs relates to the level of care that your elderly parent is willing to participate in for preventive activities, things like exercising, eating right, maintaining a healthy weight, being social. We've talked about all of this throughout many of these modules. So this is all tying it together. Then after you look at this budget, ask yourself, will there be money to care for the surviving spouse, the healthy spouse, your mom or dad? How can you set aside money? Or is there no other option? Will all of those funds be devoted to the care of the sick spouse? What happens to mom or dad when half of the household income, whether it is a pension or Social Security, disappears because that sick spouse dies? These are subjects that we don't think about because we can't even project, we can't imagine what happens when the first parent passes away. That's why it's important to talk about money to pay for care routinely. Remember when we talked about routines? Routines help us avoid procrastination, and they also make these conversations more routine, less stressful, and more practical. So you can revisit that webinar that talks about the importance of routines. And I want to talk about my parents again. So my mom was the sick spouse. My dad helped care for her, and my sisters and I helped care for her. Her concern, because my father was older, about 8 years older, and the statistics show that men usually pass away first, her concern when she became sick was, I know that my care costs a lot of money. If your father dies first, I have no idea how I would financially survive. She kept saying this to us, and we as children, I had no idea how to respond to her back then because I was not in the career that I am today. This was 25 years ago. The reality is that as far as Social Security goes, at least, the surviving spouse can claim the dead spouse's benefits. So my mother could have gotten my father's Social Security income, which was significantly more than hers, because for many years she was that caregiver who took care of the children. She didn't work until later life, and I think her Social Security was $500 a month. His was $1,800 a month. It was substantially more. The other issue was my father had a pension, and that supported them. If he would have passed away, that pension would have gone away. So basically, they would have had to live off, or my mother would have had to live off, less than half of the income that they had every month. And it's possible that most of their savings would have been gone. We didn't know how to address those conversations. You have that opportunity now because you know that this can happen to figure out how to address those conversations. And when we talk about costs in the next module, in the next part of this program, we're going to talk specifically about how to plan for the surviving spouse. And if you are that caregiving daughter who takes time off work to care for elderly parents, who is married and you take time off work to care for your children, or if you eventually become that caregiver for the sick spouse, how do we protect you? How do we make sure that there is enough money for that surviving spouse who will eventually need care? To summarize, for why there's never enough money. If your parents need more convincing about managing their health or talking about care costs, if you can, take your laptop to their home and watch this module, watch all of these modules with them. There's nothing like having another person have the conversation of caring for you. That would be me. Use the information in these modules to make a difference in your care situation. Share the information with your brothers and sisters. Use this information to educate your family members, to gain their participation and gain their understanding. You can also help them plan for their own care costs. Realize why they should take different lifestyle measures to improve their health. Teach your children. The information is here. Put it to good use. More women than men don't have enough money for their care after caring for that spouse or giving up a career to care for elderly parents. Have these financial discussions. If you're a daughter or a son caring for your elderly parents, think about planning for your own care needs and for your future. How are you going to do that? Caregiving affects health. It affects well-being. Caregivers who sacrifice their health and well-being must have options for their care when it's needed. We have to talk about this in society. We must talk about this in the families. I'm Pamela D. Wilson, caregiving expert, advocate, and speaker. Thank you for joining me for this very difficult conversation about money, about costs of care. I hope now that you are a little more informed and know how to have these conversations in your family. And again, share these webinars, share this information. It can make so much of a difference for you today in your life, in the lives of your elderly parents, and in the lives of your entire family. I will see you again in another webinar. I so appreciate you spending this time with me.